Welcome to our video about risk of falls for older adults. We're going to start with a little bit of a quiz. I'll ask the questions, and then you think about whether or not you think they're true or false. Let's start with this one. True or false? Falls are a normal part of aging. The answer to this one is false. Falls are not a normal part of aging. But risk of falls does increase as people get older, and there are a lot of reasons for this. This falls education program will tell you about these reasons and help you to reduce your risk of falls. Okay, here's another question for you. True or false? A slip or trip is not a real fall. The answer to this one is also false. A fall is unintentionally coming to rest on the ground or other lower level with or without injury. That includes a slip or a trip, and it also includes when a person goes to stand and then they lose their balance and end up sitting back on the couch, or any time that one lowers themselves to the ground safely after losing balance. Alrighty, here's our third question. True or false? Most falls happen in and around the home. The answer to this one is true. Falls can happen anywhere, but most falls happen around the home. So taking steps to make the home environment as safe as possible is important. Take a look at this example of a living room. Can you see any things that could be a fall hazard? Here are a few things that I see. This room is very cluttered. The loose rug is a tripping hazard. The books and papers on the floor are a danger. There are electrical cords laying about and someone could trip on one easily. I also notice that wherever the homeowner is, they're without their cane and their good firm-soled shoes are not on their feet. These are just a few of the things that we will discuss in this program. Here's our next question. True or false? Falls are the leading cause of injury in older adults. The answer to this one is true. Even though we know that falls are a leading cause of injury, we also know that many falls and fall-related injuries go unreported. Here's another true or false question for you. Exercise and building your strength can lower your risk of falling. This one is true. If you exercise and build your strength, you will lower your risk of falling, and you don't have to run a marathon to get a benefit from including exercise that is safe for you in your routine. A little bit of regular exercise and balance training can go a long way to increasing your safety. True or false? Healthy eating gives you energy to be active. The answer to this one is true. Not only does healthy eating give you energy, but being well hydrated and having enough protein and vitamin D can directly affect your falls risk. True or false? You do not have to fall to have a fear of falling. This is true. A fear of falling can lead to increased fall risk in itself. And many people have a fear of falling before their first fall because they feel unstable, they can see their own risk, or maybe because others in their community have suffered from falls. Learning what you can do to reduce your risk can reduce the fear of falls and help you feel more control over your safety. Let's look again for a moment at this fear of falling. Some people are afraid that they might fall, but the fear of falling can have negative consequences itself. It can cause people to be less active because they think that if they don't walk, they won't fall. As a result, people may withdraw from doing things that they enjoyed, which can lead to isolation or depression. Being afraid to do things then leads to needing someone else to do them for you. So that's increased dependence. All of these factors lead to increased anxiety and worry. It's actually a cycle. Someone who's afraid of falling might stop doing things because they think it's safer. But not doing things they once did makes them weaker because they're not using their muscles and balance skills. Getting weaker increases the risk of fall and unsteadiness. And this in turn increases their risk and increases their fear. There are many reasons why someone might fall. If you've ever had a fall or a near fall, take a moment right now and think about what might have contributed to your risk factors at that time. So why is falling such a concern? About 30% of older adults fall each year, and many of those people fall multiple times in a year. 50% of falls result in fracture or sprain. Skin injuries and wounds are also common and can result in long healing times and possible complications. Falls account for 80% of hospital admissions for older adults and 40% of nursing home admissions. They can result in injury, pain, loss of consciousness, hospitalization, loss of independence, and fear of falling or withdrawal from activities that you would enjoy. So why do people fall? Many things can lead to falls, including decreased muscle strength and flexibility, which may be from a reduction in use or from age-related changes in muscle. Changes in vision. Older adults need better lighting and may not see contrast as well as when they were younger. Cataracts and glaucoma are issues as well for many people. Other ailments may lead to reduced mobility, such as arthritis and stroke. Medications may make you dizzy or impair thinking, or make you tired or change your blood pressure. Balance, or a reduced ability to react to imbalance, may also be a factor for some older people. Some older adults have changes in memory and thinking, which may be caused by medications or a disease process, and this can increase fall risk too. High blood pressure or a delay in adjustment of blood pressure when changing position can be a risk factor. And dehydration is very common for a variety of reasons, and this can also have a significant impact. So what is your fall risk? I'm going to go through a list. You think about how you would answer these questions. Do you spend less than 30 minutes a day being active? When you think about the shoes that you wear around the house, do you wear high heels, slippery soled shoes? Are they poorly fitting? Or do you skip shoes altogether and walk in socked feet around your home? Do you take 3 or more medications per day? Has it been more than 12 months since your eyes were tested and your glasses were checked? Are there hazards in and around your home that could cause you to fall? Do you have problems with concentration or memory? Do you eat fewer than 3 nutritious meals per day? Have you fallen in the last year? Do you feel unstable? If you answered yes to even one of these questions, you are at risk of falling. Here are some things that you can control that we will talk more about in other lessons. Nutrition and hydration, making some safety changes to your home, making sure you're using your walking aids and using them properly, taking medications properly and limiting alcohol, staying active and increasing balance, and wearing proper footwear. Thank you for joining me for this introduction to risk of falls for older adults.